Good morning. Welcome to the 4 Reasons Telemedicine is the Right Call for Your Business, and thank you to everyone joining us. My name is Marnie Nesher, President of the Business Journal News Network. This webinar is being presented by the Business Journal News Network and Excellus BlueCross BlueShield. One quick item before we begin. If you have questions during the presentation, please type them into there's a question chat box located on the right-hand side, and then our presenter will be happy to answer them at the end of her presentation. Please let me introduce Janette Westman. For over 7 years, Janette has worked as a workplace wellness and telemedicine consultant at Excellus BlueCross BlueShield. In this role, she assists organizations and senior leaders in implementing wellness strategies and initiatives to promote employee health. Janette is a certified worksite wellness practitioner through Wellness Councils of America, a nationally accredited wellness organization. Janette graduated with honors, magna cum laude, earning a BS in exercise science and a minor in business management from SUNY Fredonia. She holds a master's degree in applied clinical nutrition through New York Chiropractic College. Her passion in life is to educate and motivate others to improve their own health and well-being so they can lead a healthy and fulfilling life. Welcome, Janette, and let me turn the presentation over to you.
Thank you, Marnie, and good morning. I am so excited to be here today to talk to you about telemedicine and the reasons why it's the right call for your business. But first, I just want to define what we're talking about today so that we're all on the same page. There are many variations of the definition of telemedicine, but essentially, it is the delivery of healthcare services through virtual technology using a phone, smart device, such as a tablet, or computer. And also, the terms telehealth and telemedicine can be used interchangeably. Now, telemedicine is expanding in lots of settings. And for the purpose of today's webinar, we're focusing on the opportunities and reasons to include it in your business strategy as an employer. But I just wanted to take a few minutes and share a few examples up front about where telemedicine is impacting other areas of healthcare. So one, in the provider setting, providers are using telemedicine for things like post-surgical care. So for example, if a patient just had a hip replacement surgery and it's difficult to get to the doctor's office, some providers are using telemedicine for those follow-up visits. Also in geriatric care is another example for patients who maybe can't drive or depend on someone else to get to the doctor's office. Telemedicine is a great option. Also, pharmacies are using telemedicine. They're speaking to customers over the phone and via telemedicine to discuss medications and side effects. And then legislation. Legislation is another area that's been impacted by telemedicine. Telehealth is a covered benefit through your health insurance carrier. And so we're seeing changes on the state and federal levels, which really indicates that telemedicine is here and it's here to stay. So this movement is happening throughout the healthcare industry with providers, pharmacies, and health insurance carriers. And it's really exciting because telemedicine addresses those common goals we all have, which is to increase affordability of care and better access to care. Now, the stats here are just a few examples that illustrate the current state and the opportunity. 50% of emergency room visits are non-emergencies, and 70% of doctor visits could be handled over the phone. And employees are expecting on-demand services, and many industries have responded. Think about online banking, for example, where you can now deposit a check right from your smartphone, or you can stream a movie instantly, or you can online shop where you point and click and 2 days later that item shows up on your doorstep. So telemedicine is a growing trend, not just because the employees are demanding it, but the technology is allowing for it, and employers are realizing the tremendous cost savings opportunities, which we'll talk more about. Now, we know that minor illnesses are typically not appropriate for the emergency room, but they are a big deal. Seeing their primary care physician should still be the employee's first option, but if their doctor's office is closed or if they can't get in fact, the average wait time to see a family physician is 20 days, it can sometimes be really difficult to get the care that they need when they need it. And that's often when your employees resort to urgent care centers or emergency rooms. And those options often take longer to be seen and be treated by a doctor, and they're a lot more expensive. Urgent care centers average between $80 and $200 per visit, and emergency room visits can be anywhere from $950 to $1,800 per visit. And that's where telemedicine comes in. Telemedicine can become a part of your strategy, and that's because it's ideal for employees on high deductible health plans because it's a simple, low-cost option. It's also great for mobile and remote workers, any of your employees who are always on the go. And also for rural employees, telemedicine is ideal for this traditionally underserved population. And the goal of introducing telemedicine is that you're giving your employees options. It's not meant to replace their primary care doctor, but it's designed to be an alternative for minor illnesses when their doctor is not available or they can't get to them. So, a little bit about the telemedicine trend. In 2015, more interactions between Kaiser Permanente's patients and healthcare providers were done virtually through an in-person visit. And in a statement, they said, for the first time last year, we had over 110 million interactions between our physicians and our members. And 52% of them were done via smartphone, video conferencing, kiosks, and other technology. Telemedicine is a growing trend, so let's talk about why. In a survey of 2,000 individuals from a 39-county region of upstate New York, these were the top reasons for using telemedicine. As you can see, 4 of the top 5 reasons, convenience, availability outside of normal doctor's office hours, travel, and the inability to leave home or work, relate to how telemedicine makes it easy to access care. You're busy and your employees are busy. So having a simple, quick option is ideal for minor illnesses. And also, cost is another big reason why people are using telemedicine. The cost cannot exceed an office visit copay, so it's an extremely affordable option for employees. Now, that same survey also found that 33% of employed individuals plan to use telemedicine, and that an additional 47% might be willing to if they knew more about it. Now, we're finding that the biggest barrier, which is our collective challenge, is that telemedicine is a little out of people's comfort zone. It's unfamiliar. But we know that once people use it, satisfaction is high. So the clear opportunity is around education and awareness. The secure technology is there, the quality of care is there, and the board-certified doctors are there. We just need to spread the awareness and encourage people to use it. Now, here's the current state. As you can see, despite the fact that telemedicine is a growing trend, many people in central New York and elsewhere are undecided about whether or not they'll use it in the future. And that's either because they haven't heard about telemedicine or they just don't have enough information to make a choice. And that's where you come in as the employer. You play a very large role in the awareness and education of telemedicine with your employees. And by introducing it in your organization, you have the potential to see tremendous cost savings by shifting those unnecessary and costly ER visits to the telemedicine setting. Remember, 50% of emergency room visits are in fact non-emergencies. So here are 4 reasons to try telemedicine at your business. Reason number 1, fewer sick days. The cost of illnesses are really adding up. Illness costs the U.S. economy $227 billion annually. And with telemedicine, employees can access the care they need anytime and anywhere. So that means no wait time and no need to take time off to schedule a doctor's appointment. Faster answers also mean faster recovery. So employees get back to work and feeling better sooner. Also, there's no time spent in the waiting room, where employees can often be exposed to other germs that could prolong their illness. So for example, my coworker Laura, she woke up with a fever and she had a sore throat and she was nauseous. She called in sick and she had a call with a doctor via telemedicine that same morning without leaving her home. The doctor was able to diagnose her with a case of the flu. The doctor recommended treatment and medications, and Laura was back to work after a few days. Now, she said that if she hadn't made that call and she tried to just let her symptoms play out or wait longer to see the doctor, she would have been out much longer, like over a week. But since she was proactive, she sought treatment early on in the comfort of her own home, and as a result, was able to return to work sooner. Reason number 2, fewer costs and less stress. Let's face it, being sick is stressful, and so is paying to get better. Given the choice between paying to see a doctor or waiting to see if they get better, most of your employees will choose the latter. Now, putting off the doctor leads to longer recovery times and lower productivity in the interim as they try to power through and keep working. But telemedicine is so affordable that cost is not a barrier. The American Medical Association says that millions of people are saving with telemedicine. Individuals are saving on average $300 annually on claims costs, and families are saving $1,000 annually on claims costs. And when cost isn't a barrier to seeking care, employees get treated earlier, they return to work sooner, and as a result, they have less stress related to their illness. On that note, my friend John and his family went camping last fall, and they went hiking in the woods, and he developed an itchy rash on his legs. So he returned to work Monday morning, and he opted to skip the doctor to see if the rash and itchiness would go away on its own. He was really stressed at work. He had a big deadline to meet, and he just couldn't find the time to see a doctor. Plus, he's on a high deductible health plan, and he didn't want to spend that extra money to go to an urgent care center after hours. Now, the problem was the itching got worse. So he decided to give telemedicine a chance. He had a video chat with a doctor that night who diagnosed him with poison ivy, and he was able to get a medicated lotion at his pharmacy before it closed that night. And so by the next day, he was already feeling relief. And as a result of using telemedicine, he didn't miss work, he didn't miss his work deadline. The appointment and the trip to the pharmacy all took under 30 minutes, and he didn't pay a lot. So he said he'd definitely use it again. It was a great, low-cost, and convenient option. Reason number 3 is that telemedicine can help your business and your employees be healthy and happy, because healthy and happy employees get more done. The benefits of wellness programs are well documented. employees at organizations with wellness programs are 18% more likely to go the extra mile for their organization. Also, 28% more likely to recommend their workplaces. Quite simply, wellness programs promote overall employee health and well-being. And when you feel good, you have more energy and you are more capable of putting that energy to good use. And whether or not you have a wellness program at your organization in the traditional sense, benefits like telemedicine directly align with employee well-being. So it should absolutely be included in your health promotion and benefit campaigns. And we'll talk more about ways to promote it at your workplace a little later. So another classic example of using telemedicine is when you're traveling. Now, whether your employees travel for business or just personally for vacation, telemedicine is a great option when you're not close to home. Now, a family member of mine, she travels for work often, and she had a big meeting out of state. Now, that morning, she wakes up to fly out, and she came down with what felt like a sinus infection. So she takes some over-the-counter medication. She got on her flight hoping her symptoms would improve. Unfortunately, she progressively got worse throughout the day, and now she's in an area that she's unfamiliar with. I'm sure many of us can relate to this. She's at her hotel, she doesn't have a car, she really needs to be treated before her meeting the following day. And she's sitting there calculating in her head everything she has to do next. She has to locate a nearby urgent care center. She's thinking about the cost of getting a taxi to the urgent care center, the cost of the visit, the hours it will take to wait and be treated, then get transportation to a pharmacy, and then finally back to her hotel. Now, all of these costs, logistics, and hours are adding up in her head. And thankfully, she remembered the telemedicine service I was talking to her about over the holidays. So she used telemedicine. Her visit took less than 10 minutes right from her hotel room. The doctor faxed a prescription to a pharmacy right near her hotel, and she got a quick Uber to the pharmacy, got the medication that evening. By the next morning, she said she was still a little stuffy, but she felt much better and was way less stressed as a result of using telemedicine. Another reason to consider using telemedicine is that employers that show they care have greater employee retention. Now, here's a surprising statistic. 18% of employees, almost 1 in 5, don't feel confident that their employer will take care of them. As you can imagine, this doesn't bode well for retention. Offering a benefit like telemedicine shows that you care about employee well-being and work-life balance. And when employees feel like they matter, they are more engaged and do more to support the organization, which often translates to greater retention too. In their State of the American Workforce report, Gallup reported that employees' needs and wants are changing. Employees are focused on their lives, not only their jobs. They do not want to compromise one at the expense of the other. And millennials are largely driving this shift in work culture. The benefits and perks employees truly care about are those that offer them greater flexibility, autonomy, and the ability to lead a better life. Employees say that a role that allows them to have a greater work-life balance and better personal well-being is very important to them. And I suggest you check out Gallup's State of the American Workforce report if you haven't already. It's very insightful and it lends to a lot of insight about employees and employee retention. So speaking of work-life balance, I would guess that many of your employees struggle to maintain this balance. Now, when one of your employees has a sick child at home who wakes up at 4 a.m. with a fever and nausea, it can throw their entire day out of whack. Then they're stuck because they have to take care of their sick child, but they also have to fulfill their work obligations. Now, by providing an alternative to the doctor's office or emergency room when things hit in the middle of the night and it's a minor illness, with telemedicine, you're helping to take one thing off their plate and making that work-life balance that's so important to them more attainable. That way, your employees don't feel like they have to choose between being a good parent and being a good employee. They can have a telemedicine visit with a pediatrician, have that doctor fax a clinical summary of the visit to your child's regular pediatrician so they're aware of the treatment your child is getting. And when your employees know that their employer cares for them, they will go the extra mile and put in more effort. So, how to get started? First, determine if you offer the benefit. Ask your insurance carrier or broker to confirm your benefits. Now, if you already partner with Excellus, our new member portal makes it easy for members to sign in and seamlessly access all their healthcare needs, especially telemedicine, if that's part of your benefits. Second, be strategic with your campaign. Just adding the benefit is not enough. Awareness is growing, but it's not where we want it to be yet. Try to be purposeful in your communication strategy and promote the benefit as much as possible. Otherwise, you won't see the utilization and cost savings that are associated with shifting those unnecessary ER visits to telemedicine. So here are a few ideas to consider. One, encourage people to register today. Even if they don't need the service now, if they register now, it will save them time and energy when they're feeling under the weather and actually need to use telemedicine. Also, consider providing a small incentive for registering. Send out a survey with a couple quick questions and do a raffle prize. And if you're in human resources, consider adding a tagline to your email signature, reminding people about the benefit. 3, consider your work environment and culture. Now, this is very important. The more supportive your environment and culture are, the more supportive your employees feel. Consider having a dedicated space at your workplace where employees can go and have a telemedicine visit in private. Some organizations call this their wellness room, where employees can de-stress, unplug for a few minutes, and take a breather. Highlight this benefit in your onboarding materials as well for new hires. And also ask for testimonials from employees. Your employees listen and relate to each other. And they'll be more likely to try it if they hear a testimonial from one of their coworkers. Remember, the biggest challenge we have right now is that it is just unfamiliar with employees. Once people use it, the data is showing that satisfaction is really high. We just have to increase that awareness. Another way to increase awareness is to have a letter sent from your leadership encouraging your employees to sign up, which again shows that they care and they're committed to employee health and well-being. After all, senior leadership is the key to building a culture of health that produces engaged employees and employees that make smart decisions about their health care. And number 4, work with Excellus, BlueCross, BlueShield. My team of wellness and telemedicine consultants can help you incorporate telemedicine into your overall well-being strategy. We can help you develop a communication plan. We have tons of resources, handouts and posters and videos, all there to help you launch the program. And whether you're looking to integrate telemedicine in your existing wellness program, or you need help starting a wellness program, that is our expertise, and that is how we can partner with you. A few final thoughts. Telemedicine is about providing options. It's not about replacing doctors or adding another layer of complexity to healthcare. Telemedicine is an accessible and affordable way to seek health care for minor illnesses, especially when your doctor's office is closed or you're traveling. By offering this benefit, you are supporting your #1 resource, your employees, and creating a healthier, happier, and more productive environment at work. Don't forget, you play a key role in the awareness, education, and utilization of telemedicine by your employees. Talking about it once a year at open enrollment is not effective. It's not going to produce the cost savings that you're hoping for. And we're here, we're your partner. We can help you develop a plan, we can help you with employee engagement, and we can help you with your overall well-being initiatives. At this time, I will open it up for questions.
Okay, let's take a look and see if anybody has asked some questions. Here is, okay, we have quite a few. So let me start with, what's the average wait time for a telemedicine visit?
So on average, so far, we're seeing our average wait time be around 5 minutes.
Okay. Here is a question. Interface with Amazon Echo or Google Home. I'd like to hear if you've heard about any plans for that, and if so, how soon do you believe that it will be in effect?
Yeah, that's a good question. I keep hearing about that in the news, and it sounds to me like it's still a little bit new about what Amazon is doing. I know they recently hired a director for HIPAA to be compliant with healthcare, but I would say it's still too early to tell what that looks like from our standpoint.
Okay. We've had some members, so from another attendee, we've had some members tell us that they can't find a place for payment to be entered when using the telemedicine, and wondering if you know about this or you can help.
Okay, so if it's maybe a unique example, my contact information is, I'll pull that up right now. If you want to send me an email, there are a few ways people can access telemedicine. So they can just call and they'll provide their payment information over the phone. They can use their computer, or they can use an app. So generally speaking, the payment information is taken before you have the appointment if you use a computer or app. But if your employees are having a little bit of trouble, shoot me an email, and maybe it's something we can troubleshoot offline.
And where can you find the app?
So for Excellus BlueCross BlueShield customers who have the benefit, we partner with MD Live, and MD Live has an app that's free to download on Apple or Google phones.
Okay. You mentioned that medications can be prescribed. Can you elaborate more on that?
Yeah, good question. So if the doctor believes that medication is warranted for your condition, he or she can write a prescription for any non-narcotic medication, so no controlled substances. And those can be directly sent to the pharmacy that you choose. So you can put your pharmacy down the road from your house in there, or if you're traveling, you can geolocate and pick a pharmacy that's near your location. All of the prescriptions and care that the doctors provide are fully compliant with all of our quality standards and metrics designed to provide the same level of care that you would receive if you went to a brick and mortar facility.
Let's see, another question here. Oh, okay. How do we as a provider integrate telemedicine into our practice?
Yeah, that's a great question. So why don't you send me an email, and I can connect you with our provider relations contact, and they can help you with that effort.
Another question is, would Excellus come out and provide a seminar to our folks? And if so, would there be an associated cost with that?
We are happy to come out. There would be no additional cost. That's exactly what we want to do. We have the staff available to come on site to support your employees. We also have pre-recorded videos. We have web demos. We have posters. some of you might have employees that are traveling or people who can't get to an in-person. So think about what would work best and how we could, capture the best piece of your audience. If we can get a lot of people on site, we will be there. There's no additional charge. That's our whole thing. We really want to be out there and support you.
Another question is, what are the doctors like and how are they credentialed?
So on average, the doctors that partner with our vendor, MD Live, the doctors have 15 years of experience on average, and they're practicing medicine and they're licensed in the state in which you're receiving care. So if you're in New York State, you're going to see a board-certified physician that's certified in New York. If you're traveling and you're down in Florida, you're going to see a physician that's licensed to practice in Florida. Our members are given a survey afterward to evaluate the doctor and the appointment, so we're constantly looking at that, but so far we're seeing really high satisfaction results with the appointments.
Going back to the previous question, I must have gotten caught up. In terms of that, yes, you will go out and are happy to provide a seminar for these. The question was, should they contact you directly for this, or do they go to their Excellus rep?
Either one. We work very closely internally, so if you want to shoot me an email, great, or if you want to email your Excellus rep, they'll get a hold of our department and make sure we're out there.
Here's another question. Is telemedicine covered by other insurance besides Excellus, for example, Medicare?
So good question. For Excellus, which is who I can speak about, is only our Medicare Advantage plans currently cover telemedicine. So Medicare Advantage plans with Excellus cover telemedicine.
Okay, so regarding Excellus, the answer would be yes then.
Yes, for our Medicare Advantage plans only. And if you have questions about eligibility and you're a small group or you're an HR person and you're not really sure, shoot me an email or contact your broker or Excellus rep. We can make sure you understand whether or not you have the benefit. For Excellus customers, it is available and included for all of our fully insured business. So if you're like, oh, that's me, I have telemedicine, then let's talk about how to communicate and get that awareness out to your employees. We would love a follow-up meeting with you.
All right, let's see, are there any other questions? As you can see, Janette has left her contact information on the PowerPoint presentation for people to be able to contact her with additional questions. We'll wait just a minute and see if something else comes through.
One thing I wanted to add too about medications, a lot of people ask about that. So it's designed to have a short-term medication prescription. So the doctors aren't filling maintenance medications. That's why it's appropriate to see your primary care physician first and foremost. And then also some of the common types of medications that are prescribed are things like cough suppressants, bronchodilators, antifungals, corticosteroids, and antibiotics. Those are what we're seeing to be the most common medications prescribed.
Right. If we don't have any other questions at this time, I don't see anything else. Oh, wait a minute. Oh, okay. Here's another question. Do you have to have a primary care physician to join telemedicine?
No, you do not have to have a primary care physician to join telemedicine, but when you're thinking about using it, first think, should I see my primary care physician for this, or is telemedicine appropriate? Because again, telemedicine is not designed to replace your primary care physician. It's designed to be an additional alternative if your primary care physician is either unavailable, it's the night, it's the weekend, you're traveling, it's a holiday, or you can't get out of work. Those are times to use telemedicine for minor illnesses. Certainly use your discretion to go to the emergency room in the event of a real emergency, but we're just adding an additional option in the healthcare setting. Also, what's nice about the feature with Excellus members and customers is that you can opt to have a clinical summary note faxed to your physician so that they know that you had a telemedicine visit, what the course of treatment was, if there was any medication prescribed. So we're really trying to maintain that continuity of care. And then lastly, I really encourage you all to go to the Excellus website to sign in as a member, check out the benefit, and register through our website.
All right, great questions. People have some great questions this morning. I'd like to finish up this webinar by thanking Janette, once again, of Excellus BlueCross BlueShield. Special thank you this morning to Visual Technologies for providing our technical support. We will be sending out a brief survey after the webinar is over, and you will also be receiving the link to the presentation in the next couple of days. We hope this content was informative. We appreciate you taking the time out of your workday to join us, and please enjoy the rest of your day.